Rodman, you're the office manager.
That's right.
For Dr. Rodriguez, and we should mention you are also her husband.
That's right.
And,
family business.
You work in the. We should mention that you accidentally got the job.
That's right.
Tell me about that.
One of our staff left to study, and so
to
we
go
had
back to school.
To go back to school, and I was basically the only option there in a short notice. So I kind of stepped into the role, kind of picked it up over a week, and then we. Now I've stuck with the practice. Dr. Rodriguez and I work very well together. We complement each other. She obviously does all of the dental side.
Okay.
And what I do is I help patients with the other side.
Now, you were in the financial industry before.
That's
and
right.
You told me in the green room that this is much more rewarding.
It is.
That I guess you're liking it more than you anticipated.
I do, because in finance, you don't actually see the effects of the work that you're doing. It takes a long term to actually see that. It's very macro versus here. I actually meet patients, I talk to people, I see how lives are changed. People bring gifts and food to the office. That doesn't happen in finance.
Okay.
You get a lot of grief, you get a lot of different things, but
so
here
it's a happy
people
group
are just
of people.
so grateful.
So what's that first day like? So a dental implant consultation, what does that look like or sound like in your practice?
So typically we'll have talked over the phone to answer any immediate questions you might have. But when you come in, we'll greet you, you do some intake forms, and then we'll bring you in. You will get some x-rays, a CT scan. You'll see Dr. Rodriguez. She'll perform an oral evaluation, ask you questions about what your needs are, what your goals are. And then we'll move on to the cost, which is one of the important things aside from the different options that you might have. In that consultation, we'll try to answer all your questions, including the financing questions. So that's what we'll go into the financing options, the different payment plans that we offer.
You also look at their insurance.
We do. We definitely do. We do a complimentary insurance evaluation. So what we'll do is we'll look at your plan. We'll see what kind of coverage you have. We'll file with the insurance company whatever claims that are needed. We know that you're paying for insurance. We know that that is a sacrifice. We know that you want to get as most as you want out of your insurance, and so do we. We want you to get that type of benefit. So we'll work with the insurance company. We typically accept PPOs. Those are typically through your employer or through the marketplace. But give us a call and we'll find out exactly if we have coverage for you.
So most of your patients are coming in for dental implants. How soon from the time they walk in the door, if everything works out right, can you tell them or can the doctor tell them with certainty you're a candidate? This will work with you.
Well, candidate is typically something that the doctor can tell very quickly. Once she looks at your CT scan, once she performs an oral evaluation, within 10 minutes or less, she'll be able to tell you whether you're a candidate or not. Very seldomly, it would take longer than that. Your whole consultation from beginning to end should take about an hour.
Okay.
From the moment you walk in the door to the moment you have what we hope is everything you need to make a decision.
She says they're changing people's lives in that practice.
We are. We definitely are, and to see it, I mean, I'm in the front, I see the patient coming in, I see the patient coming out. You see patients coming in nervous, you see patients coming out, and they just have this sense of satisfaction. And it's something that is very touching.
So it's more than just teeth.
It's changing people's lives. I mean, if you have to really see it and experience it to understand the impact that changing somebody's smile, somebody's ability to eat food, somebody's ability to live their life normally. We all want to live, no matter whether you're 96 years old or whether you're 17 and going to camp and you have a front missing tooth. Everyone has a need to live life and smile and put their best foot forward.